Hello and welcome to Business Reporter's Best of British Business campaign. I'm Ashley Blake. Employing 1.3 million staff, the National Health Service is by far Europe's largest employer. An organisation of this size needs to be laser focused on efficiency, and when it comes to a publicly funded health service, that imperative becomes even stronger. One area that needs dramatic improvement is staff onboarding. The NHS could save hundreds of millions of pounds by digitising the exchange and verification of certificates held by clinical staff. A new digital platform conceived in the NHS Clinical Entrepreneurs Programme is already making that happen. So we've invited the founders, Dr. Manpreet Najjar and Dr. Henry Goodyear, to tell us more. A very warm welcome to you both. Thanks for joining us. Let's get straight into the nitty-gritty, shall we? The NHS already has a well-established staff onboarding practice, so why does it need to change?
As you say, the NHS has 1.3 million employees, and as doctors we rotate frequently. But from the hospital level, we understand the pain the HR directors and the teams go through. Every 3-6 months they need to onboard doctors and nurses. And it takes a huge amount of time and a huge amount of liability and risks. Checks aren't done, delayed deployment of doctors and nurses onto wards, that becomes a patient safety issue because the staffing numbers are low. So we wanted to create a solution where we increase the trust and efficiency in this process for the hospitals so they can get on with letting their doctors and nurses look after the patients.
So give us an example of your own experience through this process, or the old process, if you like.
So the old process, I can tell an example myself, was why I went into this was there was a locum agency doctor who I was doing a night shift with, and I kept getting called to the ward every night for 4 nights. The nurses weren't sure what he was doing, and some of the decisions he made I wasn't too sure about, and patients were at risk, and there was no way for us to verify his skills instantly. And they'd just been put in there by an agency, and the hospital had to rely on that. So they were taking this huge liability. It was taking me away from my patients, then obviously having this added impact which wasn't really realised. So we thought, how could you create a digital solution that could help solve the hospital's problems and also help me on the front line and make sure patients are safe? And that's where it all started.
So not only does it save time, but it also saves huge amounts of money.
Yeah, so, and what I didn't say there is, I was comparing this locum agent's experience to mine, where I had to go in with reams of paper, 13, 14 pieces of paper, every 3 or 4, 6 months. I've been in 12 hospitals, taking my own annual leave, 1 or 2 days, but that's a 6-week process or a 5-week process, and things are lost or delayed. And it just becomes frustrating for both the HR teams and the doctors, and there's this huge frustration, there's a delay, and there's a liability. Do you just deploy this doctor, the checks haven't passed, or the doctor's frustrated because all they want to do is look after their patients? So we want to improve that, make it more efficient and increase the trust around that, ultimately to benefit the organisations, the doctors, but number one, primarily patients.
So imagine you're the HR manager at one of these large hospitals, and in 1 month, you, depending on time of year, you might be waiting on 200 doctors to be starting. And you're chasing all of these people up with individual emails to make sure that they've got all the right documents prepared, or that they've emailed you scans of the right documents so that you can at least be forewarned of what you're expecting to receive on the day that they turn up for their identity check. And then you need to scan, store, and kind of safely verify all of these documents in preparation for somebody to start work. It's a huge burden on the HR staff, and then as an individual, you're searching around for some random documents that you only touch every now and again for these HR type checks, and you're finding exam certificates, you're finding your old degree certificate, you've got reams of paperwork to get ready. Some of it's then gone out of date and you've only just realised it's a week before your identity check, and it's a multi-week turnaround to get a new form issued, or you have to go on a course to get a new certificate revalidated. So from the hospital's point of view, they've got to either accept some people have out-of-date documents and let them start their job at a level of risk, or they say, no, hold on, you've got to wait. The level of risk is too high, in which case they are short of staff.
So what sort of time window are we talking about here? From the old system compared to Truu?
So hospitals will start engaging with their new staff, if they're substantive or trainees, probably 20-ish weeks before they begin. But you won't be necessarily sharing direct information until probably 6 weeks before. And then you go through booking an identity check, and then you have an induction process. You get given your ID badge before you start. The whole process of giving log-ons for every clinical system you have, and that can be a significant number of log-ons sometimes. You have to be changing your passwords, checking your security badge start.
What we want is you to be ready on day one when you turn up to a new hospital. And I think even the amount of work HR teams have to go through, it's so much, it's burdensome for them having to make sure they meet all the regulations, then have to check all the physical documents to make sure they're genuine. But now we can say, here's a digital format, exactly the same, the equivalent, that your system can check. 5 minutes and off you are and you're ready and you can start looking after patients.
I want to ask you about data. Talk to anyone about data and the cloud, and it scares the living daylights out of people because they are concerned that their information is out there. How does Truu protect an individual's information?
So the current systems we work with right now is I have all this information on pieces of paper. Most of my jobs, they've asked me to scan it and then email it to an email address enabled to one of the HR managers. They then store that and then they take a scan. So the hospital has email copies in PDF form and they have paper copies stored. What we are trying to build is a system that when a hospital wants that information, they can directly ask me for it, not through an email system, but through our kind of enterprise solution. Us as a company, we don't see or hold anybody's data. We just simply provide a conduit for that.
Yeah, so the model is the individual is the data controller, not a third company. So it's the individual, it's that trusted relationship, and you know there's a flow of information, it's auditable. So it's empowering the individual to have control over and consent over their data. One of the drivers for the company has been driven on medical ethics, confidentiality, privacy. They align, and that's why we are sticking and why we want to do things the right way and change businesses. This technological evolution of the last 25 years has actually brought in some bad practices, which we've learnt about. We had to go through it, right, to evolve. No one knew how the internet was going to work around it. It's all about putting the individual back in control of their data.
So looking to the future, COVID has taught us all a lot of lessons, no more so than the NHS. What have you learned from the recent pandemic?
So I think personally working on the front lines as an infectious diseases physician, leading the response, the need for a tool for this to deploy staff rapidly was something we definitely needed. Our work has demonstrated a good proof point, the fact the NHS sees this and they don't want digital staff passports for flexible workforce and moving staff to where the need is. For me, I think that's the biggest thing, that realisation about this technology will benefit the healthcare ecosystem.
For me, it's got to be the belief that when the right motivations are there and the willpower is there, people can really make big changes when they accept that there's a need.
So how would you sum up Truu?
Truu is safer than the status quo.
And also, the individual is in control of their data.
Exciting times ahead. Thanks very much for sharing your story with us.
Thank you, Ashley.
Thank you.